All right, I'm going to quickly cut across to Dr. Swapnil Parikh, the author of The Coronavirus, to give us his perspective on vaccination for kids in India at a time of this Omicron threat. Dr. Parikh, is this a breakthrough? Do you believe that kids in India must be vaccinated, even though, on the other hand, we've seldom seen children below the age of 12 succumbing to the virus? They've got great immunity, but yet the threat, of course, leaves us apprehensive. Do you suggest or urge parents to get their children vaccinated?
Hi, Nabila. Thank you for having me on. As you correctly pointed out, yes, children are by and large less vulnerable to severe outcomes when they get infected. However, there are subsets in the pediatric population who are high risk because they have medical conditions, and a small percentage of a large population that gets sick can be a large absolute number. And even though the hospitalization rates for children, the fatality rates for children are low, there are many vaccines we give to the pediatric population for diseases that are far less dangerous for children than COVID-19. So I think it's a very important step. The vaccines have been used abroad, have been studied in detailed trials, and have been safe in children. Covaxin, which has been approved, which has received an authorization for pediatric use, has been given to millions, tens of millions of adult Indians. So I think, yes, depending on which vaccine is going to be used, basis, I still don't have that information. But yes, parents should absolutely take this opportunity to get their children vaccinated.
Well, Dr. Parikh, here's a booster dose that's also been spoken about. Prime Minister Narendra Modi himself declares that on the 10th of January, booster doses will be out for frontline and healthcare workers. Has there been enough evidence to suggest that a booster dose is required?
Absolutely. I think for individuals who are highly at risk of severe outcomes, like the elderly, and those who are clinically vulnerable, especially individuals who are immunocompromised, and for those who are occupationally exposed to a high infection risk. So that would be doctors, nurses, all kinds of healthcare workers and frontline workers. A booster dose for them will be very important. It's not just about reducing the risk of severe disease, which it will. It's also about making sure that essential workers don't fall sick in a very short period of time. So if healthcare workers, if a lot of healthcare workers get sick during the third wave, during the Omicron wave, they won't be able to look after patients.
Well, of course, healthcare workers, the most susceptible, those on the front lines, and also those above the age of 60. 60 plus, those with comorbidities also considered for a booster dose. At a time like this, when we're looking at the Omicron threat fast spreading, there hasn't been evidence of severity when it comes to the Omicron variant of the COVID-19. Should we be panicking at the moment? Considering that cases are only on the rise, Omicron cases are on the rise in India, should we be panicking at all?
Well, let's say that your house is on fire. If you start panicking, you'll burn to death. So you should not panic. You should respond appropriately. Don't underplay the threat, but at the same time, we need to be focused at fighting what lies ahead of us and not panicking. So we should be reassured by our action rather than becoming complacent.
Now, while we're speaking of a booster dose on one hand, only for frontline healthcare workers and senior citizens, of course, the larger population worried of the Omicron variant, also wanting a booster dose. Many of them asking, why not for us? Why not for the general population? Do you think that will also be coming up soon, like many other countries in the West?
Yeah, I think at some point we will have to roll out boosters for the wider population as well. Which vaccine, at what time interval? Those questions remain. Right now, there is an urgent need for individuals who are highly likely to get infected and are essential workers, or individuals who, if get infected, are most likely to need hospital or have a high fatality rate. We also need to meet our contractual obligations to global vaccine equity, because a lot of countries depend on India for vaccination, and they have healthcare workers, they have elderly, they have vulnerable populations. So we need to do all of that, and we need to balance those things.
Which is why my question to many of them the same to you as well. Will Indian vaccine makers be able to ramp up the kind of production to match the demand? We have a huge population, significant chunk of population between the age group of 12 to 18. Do you think Indian vaccine makers will be able to, come up with supplies adequately?
So we have a great vaccine in India that's being manufactured by Serum Institute. It's the Novavax vaccine. In India, it will be marketed as Covovax. There is an ongoing pediatric trial for that in the United States and Mexico, as well as a trial that is going to be conducted in India. And we have great production capacity for this vaccine. So I think that is eventually one of the frontline candidates for pediatric vaccination, pending the trials go well. However, in the case of Covaxin, there have been some difficulties in scaling production. So I hope Bharat Biotech and whichever other companies have the license to manufacture it can start producing Covaxin in the quantity that is required to meet this vaccination need.
Well, do stay with us, Swapnil. I'm going to quickly cut across to Dr. Rajesh Parikh as well, who's joining us live on this. Dr. Rajesh, Prime Minister Modi himself now makes the announcement, gives us the big news of vaccine for children to be rolled out as early as the 3rd of January. That's barely 10 days, not even 10 days. We're, of course, excited considering the children themselves are so traumatized, staying at home for 2 years, missing out on their curriculum. Finally, we'll be able to go to school. We're hoping for a new era in India starting the new year.
Oh, absolutely, Nabila. And, your words reminded me of something. I'm a student of history, and I couldn't help seeing your words as an echo of what was said in 1947, 2 months before India's independence. Nehru and everybody was talking of the dawning of a new era. And it's quite interesting to see you use the same language for the freedom that our children are going to experience with the announcement that is coming today.
Well, Dr. Rajesh, a lot of talk about the booster dose as well. I'm going to come back to vaccine for kids in just a moment with you. But booster doses, frontline and healthcare workers will be able to receive a booster dose as early as 10th of January. And that's, of course, something that was much discussed, while on one hand you had many of them not rooting for it. Many others pushing for a vaccine booster. Many other countries have already started with it. India now coming out with a booster dose on the 10th of January. We're still unaware. What exactly does this booster dose mean? Will it mean if a person has got Covaxin, 2 doses of the Covaxin, he or she will get the same another dose of the Covaxin as a booster dose? Or can he or she also get a Covishield or any other vaccine maker dose as a booster dose?
Well, first of all, Nabila, let us begin by congratulating each other. I know you two have been in favor of boosters. I have been one who's been rooting for this for the past 5 weeks with single-minded devotion. So I'm absolutely thrilled at the announcement that has come in. And, well, the details can be worked out. We do have enough time for that. What the data seems to indicate from across the world, that we are a trifle better off by having a booster from another platform of a vaccine. So as you indicated, Covaxin, Covishield would be a good combination. But, if there are not enough doses of Covaxin available for people who have had Covishield, because 90% of our population has had Covishield, as opposed to about 10% who have had Covaxin, then having the same vaccine as a booster is much, much better than not having a booster at all. And by the way, I don't know whether this is intentional, but I'm delighted to see my son and co-author on your program. We don't always agree on most things, but today I think by and large, he will be in agreement with me that the boosters is a great, great announcement.
And what a day to have both of you on the same platform. Of course, both of you agree on vaccine for children. Both of you have agreed for booster doses. Swapnil, would you want to jump in on the booster dose and what exactly it means? Of course, your father has already spoken, but if you want to second that, a booster dose, what kind of a dose will one receive as a booster dose? The same as what you've received? Can you mix and match a dose?
So it's funny, but just a couple of days ago, it was my dad's birthday, and I asked him, "What do you want?" And one of the things he instantly said was boosters. I want the country to have boosters. So I think both of us have been rooting for this for a long time. I think it's a great thing for India because the vulnerable populations will be protected. It'll take better protected. It'll take a little load off the health system. It'll preserve our health capacity. So healthcare workers aren't going to fall sick or be out of action when they're needed most. In terms of which booster to use, I think we really need to accelerate the Novavax vaccine, Covovax. There was a clinical trial conducted in the UK called CovBoost, in which of all the options we have, Novavax would make the best boost for both Covaxin and Covishield. Plus, it's easy to scale manufacturing there. I think with the pediatric vaccinations that will start, we'll have to preserve Covaxin currently for pediatric vaccination. So I think all boosters realistically are likely to be Covishield, at least for the immediate future.
Even for those who've taken the Covaxin?
I think for those who've taken Covaxin, Covishield would be a really good booster.
Okay. Well, Dr. Rajesh, if you can give us an insight into the immunity levels. One knows, whatever said and done, we've managed to really tide over the worst parts of the pandemic. And that sort of suggests that maybe we've now come to a situation of herd immunity. At a time like this, when our body has managed to cope with the toughest of times, we are doing all right. Do you think a booster dose or a vaccine annually is necessary if we've managed to cope with it and our immune system is already immune to this variant of the COVID-19? I mean, of course, I'm sure there are many more versions or variants of the COVID-19 to come in future, but just in apprehension, is it necessary to vaccinate ourselves?
Well, Nabila, I knew after the easy questions, the tough ones were to follow. And there are no really precise and clear-cut answers to this. But I'd like to emphasize one thing, that we have to juggle three perspectives simultaneously. Not always an easy thing to do, but a very, very important thing to do. And that is the global perspective, which deals with vaccine inequity. There is the national perspective, which is, of course, focusing on getting the second doses as rapidly as possible deployed to those who have not got it. But there is also the local perspective. For example, in Mumbai, 80% of the population has received the second dose. So I cannot quite comprehend the rationale that some people are advocating, that we have to wait for the whole country to get 80% of the second dose before going in for the boosters. So I think at the intersection of the global, the national and the local perspective lies the focus of what should be our policy. Yes, we don't know too much yet about Omicron. We have always been 2 steps behind the vaccine, at best maybe a step behind. And the virus is clearly behaving differently in the United Kingdom compared to in South Africa. That may have something to do with the herd immunity that you alluded to, or more precisely, infection-induced immunity. We don't have all the answers. But until such time as we get most of these answers, it's very important for all of us to get vaccinated as quickly as possible.
Well, and now let's shift our focus to vaccine for children. As Prime Minister Modi has just declared that vaccine for kids will be rolled out as early as 3rd of January, an age group between 15 to 18 years. Covaxin has got the nod for vaccine for children above the age of 12. Do you also believe, Dr. Rajesh, that vaccine for children is necessary? Even if they have great immune system, they can still pass on the infection. But what if there's a situation which we're almost achieving, where most of the adult population is vaccinated? Even if they do spread the infection, your adults are vaccinated and they have the protection and the shield because of the vaccine. Then do children still need to get vaccinated? Do you urge and push parents to get their children vaccinated?
A quick answer, absolutely yes. But if I may explain, there are 3 assumptions there. And the second and the third assumption are predicated on the first. So the first is our children have great immunity. And predicated on that, people are saying that, do we really need to vaccinate them? Is it absolutely necessary and things like that? Well, these are the kind of words that were used even before the second wave. I don't want to get into that. People talked of great national immunity, and then we were hit by the second wave. And, George Santayana, if I may paraphrase him, 80 years ago said, those who do not learn the lessons of history are condemned to repeat it. The lessons of past pandemics, most notably that of 100 years ago, the Spanish influenza, which we alluded to a lot in our first book on the coronavirus, which we wrote in Jan 2020, clearly tell us that the virus can change its demographic target very rapidly, like an F1 driver in Omicron. I think that's a good metaphor because it really goes very fast. It can make a quick swerve and move. It has already moved once from the elderly to 30, 40. It could very easily move to our children. And I think it's better to err on the side of being extra careful than of being very careless.
All right. I think there's no room to be careless because you have all the reasons to be careful with a vaccine for children now coming up very soon on the 3rd of January. 15 to 18 years of the age group, that bracket will be able to access vaccines as early as the 3rd of January. And this is a commitment that the Prime Minister himself made right a little while ago in his address to the nation.